Hi, my name is Beth Redden, and I'm going to give you a little bit of a technical demo here, but also I really wanted to explain how we use different ontologies in order to be able to provide different answers so we have the same patient, same day, same information, but three completely different experiences. And we use ontologies as lenses, just like the lenses of my glasses. And so we have a patient lens, a caregiver lens, and a clinical lens. But we can do even more than that. And what we specialize in is using different pieces of information so that we can fully explain how AI systems are going to be able to be experienced and be able to deliver the information in a way that the patient or the caregiver or the provider really need to see or understand how that information needs to be delivered. So for this demo, what we're going to do is I'm going to show you an interactive conversational AI that I have already put together. So if I ask, what is a TBI, or a traumatic brain injury? This is a traumatic brain injury, and this is the causes, these are the types of damage, and then it shows a picture of the page from the actual document that this comes from. So this is great. Now, what we do is we take this binder full of information, this is page 15 in the binder, and we put it through a data pipeline, and then we take a picture of the page, and then we use this page as context in order to be able to map whatever question is asked to this particular context and then be able to return the information in the way that the patient needs to return the information. So let's say that this is a patient that has Spanish as their first language. So you can ask the question in Spanish, you can return the answer, and then you can see a picture of the page from that particular answer. And then you can ask, let's, explain it to me like I'm five years old. Okay, so imagine one of your patients is a kiddo, and they really need to understand that your brain is like Jell-O inside a bowl, which is inside your skull. If you shake and you bump it, etc., etc. Again, same exact context. So the provenance of the context is always going to be the same, regardless if you need to deliver the answer in Spanish or in 5-year-old or in Vietnamese, etc. So how we do this is we use different ontologies as lenses, as I started at the beginning, but we also use different ontologies to be able to use as a map to be able to retrieve the specific context for that specific person at that specific time. The ontology provides scaffolding or an understanding of the reasoning that is behind this so that we understand that a traumatic brain injury is part of a cerebral edema, which is part of an edema, which is part of a pathological finding. We know that for fact. These are facts that we can then use abductive reasoning and transitive inference to be able to truly understand why the AI system actually gave that answer in the context by which it gave it. Thank you very much for your time.